You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about dental implants today, what you need to know. With us, we have a very experienced dentist that a big focus of his practice is in dental implants. I've had him on the program before. He's back by popular demand. Also, we begged him to come back on the program, so that helped a little bit. Dr. Huenergardt, how are you?
Very good.
Welcome to the program. And you're also my dentist.
Yes, I'm very honored to have you there.
So I feel very, confident. We were talking, and I said, save it for the show, because we're talking about like no more dentures. With as little as 2 dental implants, you can have something that snaps in and out. But you were about to say, and I said, hang on, we're about to start. You said, we didn't know how miserable denture wearers were.
We had no clue.
Tell me about that. What do you mean by that?
We had no clue. Back in the early stages of doing, placing dental implants and restoring, we didn't do one tooth implants back then. It was all, the original invention was to replace dentures back in Switzerland, Dr. Brandemark. So when we started doing these and treating people and replacing their dentures with teeth, we didn't realize what a big life change and what a big a life event this was. And how the trauma that these people went through and being ashamed of losing their teeth and how it affected their lives. I mean, they'll eat in a corner in the restaurant.
You said that. You said that a denture wearer will eat away from everybody else.
Sometimes, and they're afraid of it coming out. They're afraid to laugh because it could just lodge it.
They tell you this on the consult?
Yes, and if you get air behind it, it could fall out.
I'm surprised. I mean, I think it was you that told me that some people have dentures and they don't wear them.
They don't wear them. Yeah, I have quite a few people, especially people that gag. We don't know that people have a gag reflex when we make them a denture. Of course, we find out during the impressions, and they can't tolerate it. Or they just feel more comfortable without it. It feels like it's trapping their gums. They feel confined, or they feel that it might come out.
Okay.
So a lot of it's soreness, though.
Now, my father, who I'm going to send to you, but my father, he thinks he's okay with dentures. He thinks he's okay. He's going to get dental implants, but he thinks he's okay. He says, well, it was very interesting what he told me. And I said, he goes, because there's no pain. They don't hurt. My teeth used to hurt all the time. I have no more pain anymore. And I said, yeah, but look, dental implants, because, you've convinced me, the dental implants are good. I said, but dental implants don't hurt. Hurt. Yeah, he goes, but when I chew and things like that. So maybe that's a misconception that, with all this, because I remember my father with the dangling teeth. I mean, they would literally move when he talked, that maybe they're just happy to have those teeth out.
That's correct. They feel that they have improvement in life just by having the denture. But what they don't realize is that their jaw is in continual change and movement, and over the years, they are going to become a dental cripple where they can't tolerate the denture, especially somebody that's very young that has their teeth out. If you're in your 50s or 60s, you still have 20, 30 years of life possibly, and that ridge that's holding the denture is going to just melt away.
Yeah, he needs a reline for his denture, and of course he calls me. He says, "Well, what do you think about dental implants? How many will I need, et cetera, et cetera." So there's a lot of people out there that kind of suffer with their denture and can't even eat and chew.
And with as little as 4 implants in the upper jaw and 2 in the lower jaw, they can preserve the bone around the implant for about 5 millimeters each direction, and they won't lose bone there ever again.
And people could be like 70, 80, 90 years old and get dental implants. Is that right?
I just placed on a 91-year-old woman.
A 91-year-old?
She looks like she's 70, and she doesn't look like she doesn't think like this is the end of her life. I still have my life ahead of me. If she lives 5 more years, she's going to enjoy life that much more because she has secure teeth.
Okay, so a 91-year-old getting dental implants at your office, and what is her motivation? It seems like, why would they even want to do it? Why would they want to go through the process?
It's her enjoyment of life. And she already had 4 implants in place. She didn't like her overdenture that snapped in. And I'm not saying that most people aren't going to like that, because for most people that's satisfactory. But some people just want to go back to what they were like with natural
It's like getting
teeth.
her teeth back. So is it about eating and chewing for her more than anything else?
She feels confined with her tongue.
Okay.
She feels that it's too confining up there, and she wants some more room. And I showed her, the difference, and she could have more room for her tongue and feel more comfortable.
And so that's it. Now, I've had you on my program talking about sedation dentistry, whether it's nitrous. These denture wearers are probably really afraid of the dentist. If you're 70 years old, okay, some aren't, but the ones that are, they can be sedated.
They can be sedated.
I have certain dentists that say every one of my implant patients are sedated. What about you?
It's very rarely are mites
really?
sedated, because it's not really a painful procedure. There's no actual nerves inside the jawbone. it's mostly soft tissue. So with my 3D scanner, my CAT scan, I can see in 3 dimensions what their jaw
So you
looks
have
like.
one in your office?
Correct, I do. It's amazing technology. And
How
I
much
can
does
actually,
that thing cost, by the way?
about 100,000.
Is that right? Because I know your prices are good. I mean, I mean, it's about the same wherever you go. I mean, competitive as far as prices, right?
Correct. We're in the range of everybody. We're probably about 30% less than most oral surgeons. Because
Really?
I'm doing both sides. I'm doing the prosthodontic side, the restorative part, where you put the crown on, and I'm doing the implant side. So I don't need to, I'm getting both sides of the treatment.
And you have people driving from South County
All the way up to Oceanside.
and I mean, really? I mean, you're having that all the time?
Yeah. I have a patient that's coming all the way from Pennsylvania right now. And he's a sedation patient, and his mother-in-law is a patient of mine, and he doesn't feel like he's getting the care that he needs because he was ashamed of his smile. So he's coming out here, and in 3 trips, we're going to have his full mouth rebuilt, along with, I think, 6 dental implants.
Okay, for the denture wearer watching this, okay, why is it, in their 70s, in their 80s, what used to take 9, 10 months, maybe even a year to do, you guys can do in a visit or 2?
It used to be that the waiting periods were because of the type of implant, and now they've enhanced the surfaces on the implant, so they adhere to the jawbone much more quicker.
Oh, really?
And within 3 months, we can usually restore them. Sometimes immediately, I can restore them.
And people could, you could do the implant in the bone, and they could walk out with a tooth on top?
Put the tooth on.
Same day?
Especially with front teeth, I can take out the root, put the tooth in. Sometimes, if it's a very nice cosmetic case, I can even use the same crown that they had, stick it right back on top of that implant, and they walk out with the exact same tooth they had. It's amazing. I've done that maybe 100 times in the last 8 years.
And imaging, we were talking about what used to take 12 months, and you were telling me that imaging is so much better now. You almost pre-plan the surgery before it happens.
Right, we can do it all on computer. So
is that right? I mean, do you do that, or is that?
I do all the measurements, and I usually do it 3 times before we put the implant in, just to make sure there's zones of safety that we have for precautions.
Now you use guides when placing implants. What does that mean? What does that mean?
It's something that fits over your teeth or jaw and has a hole in it exactly where we want to put the implant, and that could be matched up with the CAT scan. So we can plan the surgery ahead of time with the CAT scan, and then put the implant exactly where we need it, and the depth we need it too. So we avoid any.
So it doesn't hurt. I mean, my father's fear was, he said, my teeth don't hurt. That was his big thing because he remembered his teeth hurting. Once they get it, I mean, they can chew and eat, and there's no like weird little light pain that they report, 6 months later, things like that.
No, nothing. No. They just feel comfortable. They feel like their teeth are supported or their denture is supported, and it feels comfortable. They can chew with it. It feels like a natural tooth. So you feel the vibration of when you chew on the implant. It actually gives vibrations into the jawbone, and that's what makes it feel like a natural tooth. So even some of the denture wearers, which was very strange that they convey this to me, is that they feel that they got their own teeth back. Even though they have a denture, because they feel the vibration when they're chewing, and it transmits into their jawbone, and they feel like they have their teeth back.
Okay, you brought a lot of models. What do you want to start with? What is the big jawbone over there?
This one here just kind of shows you what happens when we lose our teeth. We have jawbone there to hold teeth. That's the only reason it's there.
Okay.
And to chew food with. That's the way we were designed. When the teeth are gone, within the first year or 2, you lose about 30% of the jawbone.
Really?
So, and that continues on through life at a slower rate. The initial loss is probably the most, but now you're having pressure from a denture onto that jawbone.
So is that why dentures have to be relined?
Correctly.
Because you are losing bone?
Yes.
Interesting.
They have to be relined every 3 to 5 years, and most denture wearers don't do that. So then there's more pressure points, and then you start getting these wavy areas. And your denture should be remade every 5 to 10 years.
But by the time they get to the bottom, when they lose enough bone, then they can't get dental implants.
But Randy, they can, because there's down here, that's about 8 millimeters of bone. We have 8 and 10 millimeter implants that we can fit in that area, and it goes right through this area, and we put the snaps on, the denture snaps in, keeps the pressure off the softer tissue that forms. When you lose all that bone, you actually get a softer tissue in there called oral mucosa that's very painful.
Okay.
And it keeps that pressure off that, And
You had to throw in those fancy terms, dental terms.
Yeah. But it's true. You lose that hard salmon pink that you have in the roof of your mouth. That's also over your ridge on the lowers. It's gone. Now you're into softer tissue.
So you can have a beautiful smile again. And these dental implants, the 2 implants, and people just tuning in, with 2 implants for denture wear, they can have something that snaps in, snap out.
And it doesn't slide all over.
And they lose the adhesive.
Because a lot of them, when they bite together, it slides forward.
Okay.
The denture, so it's sliding around in there. And when you're down to this point, you're what we would classify you as a dental cripple sometimes.
Okay, so with 4 implants, 6 implants, they could have something that's permanent, that doesn't come in and out. Is that right?
Yes.
I'm Randy Alvarez. You're watching The Wellness Hour. We will be right back.
I probably went 10 years without smiling fully because I was very conscious, and my teeth were just falling apart into my mouth. At times I'd have to get them out. I'd have a job, or I'd have to excuse myself and then come back when the tooth was already in the wastebasket. I tell people I don't like dentists. Ever since I was a child, if they hurt me, I bite them. And I think Dr. Huenergardt is great because he gave me Novocaine and pulled all my teeth. And I never had to take a pain pill, nothing. And he ended up doing one by my sinus cavity. I no longer have sinus headaches. I'm so happy. That's plus the fact I can smile now.
I had absolutely no teeth on the top, so I went to Dr. Huenergardt. He fitted me with a set of implants, which involves 6 implants, and now I have a full set. I can eat steak, I can eat corn, I can eat apples, I can eat anything that requires a bite, even a simple thing like a hot dog. Absolutely no pain. There's no pain to it. He gives you a sedative. You're practically 2/3 asleep during the whole thing. And, before you know it, he's sitting you up in the chair and you're ready to go. Yes, I wish I'd have done it 5 years before. But this particular method was only developed 4 years ago. So I've got the latest in implants. If you're missing teeth, go in and get yourself an appraisal and have Dr. Huenergardt give you a good idea of what the whole procedure will be. And you'll be quite amazed at the whole process, really. Don't wait. Get it done.
Hi, I'm Randy Alvarez, host of The Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about no more dentures. Get a fixed set of teeth in just a couple of appointments with Dr. Huenergardt. And by the way, one of my favorite guests that we have on the show. And you're my dentist. But I don't have dental implants.
I'm privileged to have you.
Okay, I don't want people thinking I have dental implants just because I'm interviewing you and say you're my dentist. But it's true. I mean, I could go to anybody. I go to you.
I'm lucky to have you.
And it is a very easy situation when I'm there.
Yeah, I'm glad
Your
you enjoy
hygiene,
it.
I mean, you really do have a nice staff. In fact, the one gal's been with you for like 20 years or something, or almost 20
About
years?
15.
15 years?
And she is actually 6 years old, and she's been practicing dentistry for over 30 years and loves it.
She's how old?
And I'm going to miss her when she retires because I love her laugh.
You said she was 60 years old.
Yeah.
She doesn't look
She
60.
doesn't, no, she doesn't.
Yeah, no,
She's
that's very
excellent.
interesting.
She's excellent.
Very interesting.
Very
Okay,
caring.
so you brought models, you brought some photos. We're talking about dental implants, as little as 2 implants. Get something snaps in, snaps out. You have the imaging there. You have sedation dentistry. I mean, it's all done under one roof.
Correct.
Is that right?
Yeah, we do everything there. We do the imaging, so we know exactly where we're placing the implants. I make my own guides because I'm very particular about where the implants go. And
Okay, good.
we
And
do
you
it
know
all
what you're
there.
doing. You know what you're doing.
I know what I'm doing.
Okay, let's take a look.
So this first picture I want to show you is just what happens when you've worn a denture she's 25 since she's had her denture. She hasn't had a new denture for 25 years.
Okay.
So you can see that her nose has gotten much closer to her chin. And
Because why?
because of that bone loss, where the ridges, she's been chewing on this denture for so long.
So by wearing a denture, you lose bone.
Right.
So her nose and her chin are starting to
It's
get
a
together.
collapse. You get that
Interesting.
mid-face
Okay.
collapse.
Okay.
And it's also harder to chew because your muscles that are at full extension, when you get your teeth all the way together like that, you can't chew as well. So you need to replace all that lost bone with acrylic, with pink.
All right.
And so here's what we did for her.
Nice. How many implants for her?
We placed just 2 for her on the lower, and we just opened up the bite. We put longer teeth in there, and she was able to smile, as you can see in the picture.
So snap in, snap out.
In, snap out.
They love that stuff, by the way?
They love that stuff. And they can chew much, much better with their
And I know you do, from root canals to everything in your office, but is the dental implant patient, the denture wearer, that makes the switch over to dental implants, is that the happiest?
That's the happiest.
They're the happiest patients.
Yeah. The sedation patients and the implant patients are probably the 2 happiest that we have.
Really?
Because they have the relief of not having to go through what they've been through, that silent suffering we talk about, that you and I don't know about until.
Are you ever surprised when you do your interview with the patient, the consultation, with how much their teeth, their denture, is getting in the way of their life?
We get people, especially the people that just first get their dentures and they haven't been able to adapt. I mean, I had one gentleman from Encinitas came up to see me in Oceanside, and he wouldn't wear his lowers or his uppers. And they were made adequately. Actually, the dentist did a very, very nice job on it, and he just wouldn't wear them. And we relined his upper, and we put 4 implants in the lower, snaps in, and he's called me up and says, I could chew steak, I could chew everything.
Is that right?
He says, I'll go on Randy's show.
My show.
Yeah, he said that.
We got to get him in here.
We do.
He's eating. We got to get some B-roll footage of him eating a steak.
Oh, yes.
Is that right?
He's
that's good.
He's a happy camper.
Do you get recognized, by the way, from TV when you're out and about?
Yes, I do.
You do?
Yeah, especially in church or something. They say, "Oh, we saw you on TV this morning," and so it's.
Do they ever ask about me and say, is he a nice guy? No, I'm kidding around.
They do. They said, "Oh, I have one patient. I just swear, I think he really likes you." So
yeah. Well, I do. I mean, you're my dentist. You got to tell him. Well, he's my patient.
Yeah.
Okay, so you brought models. What else are we looking at there?
So that is basically the first
let's go
one.
over the
We're
options.
talking about the options. This is the 2 implant option.
2 implants.
This is the lowest cost option. The denture has snaps in it, so it snaps in.
Let's take a look at that.
And it
is this real? I mean, this is what it's going to feel like?
That's exactly.
Okay.
A little bit more retention than that. It's been in and out a bunch of times.
Are there people that have even a tough time pulling these things out?
Yes.
You have to soften it up a little bit?
You just have to teach them how to get it on the lower. They can just pull it, get their finger back there and snap it up.
So and on the console, do you bring out this?
I bring out the models because I like people to know what they're getting.
Okay.
We're visual as people, so if you talk about it, I like people to see it. So this is the model with 4 implants, 4 snaps, and as you can see, it's much harder to pull loose.
Okay.
And that's probably the ultimate of the locators.
So 4 implants on the lower.
Right.
Snap in, snap out.
Snap in, snap out.
Okay.
There's some there's some support by the implants, so they're comfortable when they chew. There's no compression of the gums.
Do you send these out? Or do you make it there in that little lab of yours?
I have an old-time lab technician that is amazing. He's down here in Leucadia, and he works almost solely for me. He works for a few other dentists, but I keep him busy enough with what we do.
But you do make things but you do also do dentures. I mean, you make those on your own, or you send those out too?
I send these out, and I approve the setup, and so does the patient. Make sure that they enjoy a good smile.
And they could kiss again, they could eat again, and all of those other things.
All those wonderful things.
So the next level up, besides the
next level up is what I would call the Cone Denture. It is held in by cones. They're gold cones, and it is very, very retentive. When they chew on this, the gold actually grabs onto it, so you almost can't get them out. And the reason I like this is it's very easily convertible to a completely fixed later on.
Fixed. Nice.
So it's cemented in, and you can see that there's much less in the patient's mouth. So when I show patients all of these options, they automatically gravitate to the completely fixed. I like to call it cementable because it can be removed by a dentist, but it stays in for the patient. It's permanent.
And they don't stain. Are those made of porcelain? What are they made of?
They can be made either way. There's a cost differential if they want them made out of porcelain, or we can do it with denture teeth and held by acrylic.
And how well, I mean, you have to just brush them, you don't have to floss.
Right, and using a water pick.
Water pick.
Underneath. Also, a floss threader is good.
What if their gums are too bad? You know, somebody says, okay, my teeth, they've been told their teeth have to go, but they have really bad gums. They could still get dental implants?
Yes.
How?
If their teeth are out of there, then
But their gums are bad.
The gums will heal up. The reason the gums are bad is because there's inflammation and there's deposits on their teeth that have caused the gum disease. So it's not actually the gums that are bad, it's the teeth that are bad, or the pocketing that's forming.
So the
around
infection
the infection
goes away when...
once you take the tooth out.
All right.
And we can actually take the tooth out, place an implant the same day. And the reason we can do that is we pre-medicate with antibiotics a few days ahead of time, and then we have the laser. And the laser will actually kill bacteria. So we can many times do same day placement, even in the presence of infection.
So teeth in a day, things like that.
Yes.
And so, I mean, you're going to give, your oldest patient right now is 91 years old getting dental implants.
Correct. That's true.
And
she's so excited to get it done because she's been all over the place. And, you know, she has 4 implants, and she likes that. She likes it much better than having a denture.
But they snap in, snap out.
Right. She wants them so they don't come out.
And then her life will be good.
And then her life will be good.
So these are people, by the way, that were wearing dentures for like 20, 30 years. And so they went through 30 years where they could have had dental implants.
Well, the technology's been around since 1968. The first one type of implant that we've been placing has been since 1982. So we're almost, 20 years into it in San Diego County. So yeah, 20 years she could have had, she'd have more bone back then too.
You have more photos to show me? What else are we looking at here?
Well, this woman here, she is in her early 60s, and she just recently got into the dating scene because of life's events that happened. She went through a divorce, and she was very, very worried about her smile because she had the worn denture look, as you can see. And
so that's a denture.
And also the roof of her mouth, she had plastic in it because she had a denture. As you can see, there's plastic when you have a denture.
Interesting.
And that was very embarrassing. She was afraid that her prospective mate or person she was dating would
kissing
find
and
out,
things like
kissing
that.
and things, and eating at a restaurant, and just not having the smile she could be happy with. So this is she went and she actually ate implants, and so this is actually what.
So that's what it looks like.
That's the actual prosthesis, and it's cemented over each implant, and with permanent cement or semi-permanent cement. So I can remove this, but she can't. And then here's her smile after. This is a kind of extreme close-up. It didn't print as well, but
Very nice. They look natural.
very natural. And she wanted to go for more natural arrangement. We can get them straighter or whatever the patient wants. So she approved this, and she liked them a little tiny bit of crooked. So she didn't want her people she was going to be dating to find out and know that she didn't have her own teeth.
Is this one of those things, and I've asked you this before, but do they say, I mean, specifically, I should have done this years ago.
It changed her life. She had a denture since she was 25 years old. Can you imagine that?
25.
25. So that's, was that 35 years? She's had a denture, so.
Does she say it feels like her own teeth?
Yes, and it communicates when she chews, and she brings us bagels every time she comes in. She does. She goes,
Do you eat them?
Panera Bread, and brings us the bagels.
You eat the bagels
Yes.
when you're there? Only one bagel.
Only one half.
Okay. And, but this is a person, but there's a lot of people. Would you say there's thousands, tens of thousands of denture wearers in San Diego? I mean, is there any estimate out there?
There's a large senior population. There's a large population of people that smoke that are losing their teeth.
So there's got to be 50,000 people probably wearing dentures, upper or lower, in San Diego.
That's a lot. There's 40 million in the United States.
Okay.
So I don't know what that translates into California.
Okay, but why aren't they doing it? Why, if it's as good as you always say it is, 10,000 minimum. I mean, there's got to be 50,000 denture wearers in San Diego. Why aren't they all doing this? Why aren't they all coming in and saying 2 implants, snap in, snap out?
It's either fear of pain, or just fear of the dentist, or finances, because they're worried about the financial aspect.
They think it costs too much?
Costs too much.
Because they count their teeth. But it's only 2 implants.
Or it's time. And we have solutions for all that right now, because you can take out all their teeth, put in dental implants sometimes the same day, not on everyone, and they can leave with implants in place and not have pain
one of the
or
things
swelling.
you pointed this out in your last interview when we talked about implants before, that you say that denture wearers don't go to the dentist. So nobody's telling them to do this.
Right. They don't think they need to. Once they have I have a denture, I don't need to go to the dentist. But that's not true, because after a while the dentures become wobbly and they need to be realigned. So we usually don't see the denture wearers until their denture breaks in half, because acrylic gets old after a while. That holds the teeth in the denture, and so they snap in half, and then
So there's no such thing as a happy denture wearer, in your opinion?
not very many. I mean, they're happy because they overcame the pain that they had from their teeth, but they're not happy that they lost their teeth. They're happy that they don't have the pain anymore. So, but they're not happy when they're chewing and they get a Kaiser seed underneath there and they have to run to the restroom and clean it out.
So get either 2, 4, but everybody wants a fixed set of teeth.
It used to be we have to put in 8 or 10, and now the implants are becoming so retentive and very minimal bone loss or none over the period of their lifetime that they don't need to have 8. They can usually get 6 and get a full. So the prices have come down a little.
Final message, though. Somebody watching this, denture wear, missing teeth, what's their first move?
First move is to make call us at my office, speak with Jennifer, make an appointment for a consultation, and get a chance to meet me and come in and find out what your options are. It doesn't cost you anything. And
it's a free consultation.
Free consultation. The reason we do that is because sometimes price is a barrier, and if they think that they might want to see somebody else, it's going to cost every time they come in and get a consultation.
And you don't like to give a diagnosis over the phone. What does that mean?
Well, we don't like to let people know what the costs are because everybody's different. Plus, you're making a diagnosis and a treatment plan over the phone when we don't even know if you're a good candidate yet.
Is it true there's a lot of different types of implants? Implants vary?
There's so many different. We have the single tooth implant, we have 2 and dentures, and we have the cemented permanent teeth. So it's hard to know what you need and what we can do.
So you give them several treatment plans in writing when they get there?
We'll give them 2 or 3 or wherever we think they. Like I have one guy right now, he has like 4 different combinations, so we're giving him that.
Okay, so you give them options.
You give them lots of options.
And they get to meet with you.
You get to meet with me.
That's the best part?
That's the best part. The most enjoyable part, because whether they choose
really?
me or
You're
not,
serious about that?
whether they choose me or not, it's always nice to meet new people. And
good for you.
I really appreciate that they give us a chance, and nice to meet them and go over their different options with them.
All right, I want to thank you for coming on the show. Very
Thanks for
good,
having me.
always a pleasure. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you can go on our website at wellnesshour.com and put in Dr. Huenergardt. That's probably tough to spell, so you could put in San Diego Dental Implants, and you'll find him there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.